Hey YouTubers and YouTubies, if you can see really quick on my camera, my lizards are moving around. That was happening right when the camera got cut on. Part 2 of the gastric adjustable banded or lap band procedure, your hospital stay, and again I'm going to preface this is based on my bariatric facility. Yours might be different. But this is what should happen. You wake up after surgery. You'll wake up in a post-anesthesia care unit. You will have a nurse with you the entire time you are in recovery. You'll have a monitoring equipment on you when you wake up. A blood pressure cuff. That thing. Pulse Oxymeter probe on one of your fingers. You see that in the movies all the time. They always have that little thing with a light on it on their finger. Heart monitor leads. Little things coming off with a machine next to you go beep, 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 beep. Nasal Cannela, which delivers oxygen cannula, however you'd say that, oxygen into your nose, and that's that little tube they stick with those little things in your nose that they feed that tube behind your ears. They're going to have that in your nose so that you're getting oxygen. Sequential Compression Devices, SCDs on your calves to help blood circulation in your legs. Because you got to have, they do that to make sure you don't get blood clots while you're not moving around. They'll request you have those cuffs on your legs anytime you're laying down. CPAP machine if you require one. Anesthesia may use during your recovery period. When you're waking up, you'll be taken in your bed to a private room on the metabolic surgery unit at my facility. The metabolic surgery unit, once I get there, a nurse will take my vital signs, monitor my bodily functions, and check equipment. My vital signs and assessment schedule would be as follows. Once every 30 minutes for 4 hours, so that's going to be 8 times. Then once every hour for 4 hours, so that would be 4 more times. That would be a total of 12 times. And once every 4 hours for the remainder of my stay. So every 4 hours, I'll only be able to get sleep for every 4 hours. For you adjustable gastric bands / lap bands, you may get to go home the day of your surgery. The girl who's having her lap band application done is outpatient. She's going to go home the day of her surgery. I'm having a sleeve, so I'm stuck in there for a day. You can spend the night depending on your insurance or related issues. Ice chips, 30 milliliter every 30 minutes, or other cold clear liquids, if tolerated well for 4 hours, increase to 60 milliliters every 30 minutes, then the bariatric diet day 1, which would be the clear liquids that you get to do. Activity the day of surgery, up in the chair for 30 minutes as tolerated, and progress to walking in the hall. My thing is that I want to get up out of the bed just as soon as I can and start walking, because I don't want to throw a blood clot in my leg, my arms, my chest, my heart, or my brain. No, I don't want that. That's not happening to me. Your incentive spirometer every 2 hours while awake. So like I was saying on the last video, you're going to have to blow into that spirometer frequently at my facility and prove to your doctor that you've actually done it. He's probably going to come in there and watch you once or twice or 3 times. Wear your SCDs while in your bed. So if you're ever laying down, you got to make sure you're wearing those cuffs on your legs so that you don't throw a clot while you're not moving. You just had surgery. Your body's in shock. It doesn't like it. So what it does is it does things to try to recoup itself. That's just the way the body is. Activity. Walk in the halls at least 3 times this day. I'm going to be a walking fool, I hope. And the pain won't be so much. Up in a chair for meals. So you're going to have to sit up to eat, because they're not going to let you eat laying back. And again, SCDs, those are those cuffs on your legs when you're in the bed. Continue incentive spirometry every 2 hours while you're awake. So every single 2 hours, While you're awake, you're going to have to blow into that thing. You'll be required to do this sitting up on the side of the bed or on the chair. Now, if you have a digital timer that can go up to 2 hours, like an egg timer that's digital, you can time yourself. You just set it for 2 hours. When it goes off, you know you got to go breathe in the breather machine. I might have to go look for one that's a 2-hour one today. They're going to be teaching you at my facility how to take your Lovenox injection once you go home. You'll be receiving a Lovenox injection after discharge from the hospital. Your prescription for Lovenox will be given to you prior to surgery. Leave your prescription at the pharmacy, but do not pick it up until after surgery. Oh, so we were thinking we were going to go get this thing today. I have to tell my husband we don't pick this up until after surgery. You will watch a video and have demonstration by your nurse on how to give yourself the Lovenox injection prior to discharge. You'll be given a Lovenox prep kit including video, sharps, container, and alcohol wipes. So you're going to have to do that every day for however long they want you to do it. Exercise. Reasons to exercise to maximize your weight loss. You will lose greater percentage of excess weight. You'll keep excess weight loss steady, and you'll plateau less often. Prevent blood clots after surgery. Walking causes leg muscles to contract and promote circulation in your legs, so you won't have a blood clot if you're walking. Limit loss of muscle mass. Rapid weight loss can cause loss of muscle tissue along with fatty tissue. Preserving and increasing muscle mass will increase your metabolism, so you burn more calories every day. Improve your health. Every body system benefits from exercise. Heart, lungs, vessels, muscles, and mental health are all improved with regular exercise. Types of exercise that you can do. Aerobic cardiovascular. Exercise in your target heart rate zone. Aerobic exercise 5 to 7 times a week for 30 minutes a day. Right now that seems like a whole lot to me. Resistive strengthening exercise. Must wait 6 weeks. After surgery and have the physician's clearance to begin strength training. Resistive exercise 3 times a week. Weight training is essential for increasing bone density after surgery. Weight training will give you a more toned appearance and may decrease excess sagging skin. My next thing that I'm going to tell you about is going to be about the Roux-en-Y, or the gastric bypass / gastric sleeve, which is what I'm getting. So if you're interested, even if you're getting lap band and knowing the things that you have to do for that, then stay tuned to the next video. If not, then you've gotten all the info that I can give you for lap band right up to today. After I'm done with the Roux-en-Y gastric bypass gastric sleeve info, I will give you some updates of stuff that's going on in my life personally right now that have to do with this, like the pre-op orientation I went through, and then my last visit with the doctor that I just had yesterday, and my phone call that I just got a few minutes ago from the hospital. I'll let you know what was said on that. So anyway, everybody, thanks for subscribing. I got 2 new subscribers since I did the last video, and this video and that video are only maybe 30 minutes apart from each other. So I got 2 new subscribers. Thank you for subscribing. I hope that you're learning a lot of information, and that I'm clear and concise, and that it makes sense to you. If you have any questions, don't feel bad for asking. That's what I'm here for. I'm not a registered nurse. I'm a patient just like you. I'm going for gastric sleeve. I just have a desire to be able to share the information that I have and that I know, and let you all know what's going on and how to take care of yourselves and each other. And have a great day. Bye.